Dr. Bird, besides all staff of all the companies represented today being able to see that magnificent presentation that you did, what are some practical ways to get staff involved? I mean, the blue gym, the green gym, that's terrific, but things that you've actually said to people, just do this.
I mean, we've been looking at this for trying to get from Natural England to our own staff as well. We've got 2,000. And what the evidence has shown, and Dame Carol Black did a good report showing actually the people at the top have got to be involved. You know, it's got to come from the top. There's got to be consultation as well of what people want in the whole workforce. It can't be forced to do things. It's got to be people want to do. But once you get that critical mass of people involved and you get people from the top actually pushing it forward, and I've got an example of Ginsters. Now, Ginsters make the most unhealthy pies in the world. They're in Cornwall. But they've got a factory that operates 24 hours a day, stainless steel, and not great for staff. They had massive absenteeism, productivity was going down. And what they found was actually by going to the staff and saying, look, let's get you out doing rock climbing, canoeing, let's get allotments around the factory and produce our own food, and you can look after it at lunchtime and keep the allotments going. Let's get your families involved. Let's get the routes to the factory so that you can walk or cycle rather than have to come by car because it's only 2 or 3 miles away. They did all those things, productivity went up, staff absenteeism went down, and retention has remained. And that was coming from the top, defined with staff, and it worked. And that's trying to be replicated, and it can't be done everywhere, but that was a great example of how you can do it.
Probably a little bit personal, but I love people who practice what they preach, just starting with the good doctor on the end. What do you do in a day that helps your health? Because you're under a lot of pressure. Anybody who's a doctor of medicine knows it's just patient after patient.
I cycle in London, which is probably kind of evenings out whether you're going to live or not. And I'm not sure how much the benefit is. I cycled here in Melbourne. I tell you, it's a much nicer experience here than it is in London. I try to do that because the tube and the buses and walking, and I try and run, play tennis with my family. I find I don't do as much as I need. The recommendations are 5 days or 30 minutes 5 times a week. I struggle to get that in a life, and if I struggle knowing what I do and with the physical activity allowance, it's really difficult.
Wayne?
Didn't know you were going to ask that question, David. Well, I guess my regime is trying to do something every day, so I try and either swim or walk every day. So I swim probably about 5Ks, 7Ks a week. I probably try and walk early in the morning usually for up to about 3/4 of an hour. I consciously try in the number of meetings that I have during the day to walk to those meetings around the city rather than take any form of transport, deliberately leave the car in the garage. And then on the weekend, I happen to live down on the magnificent Great Ocean Road, so I get plenty of opportunity to get out and about on the weekend as well and practice exactly what we're talking about here. I certainly notice the impact on my ability to actually stay energised during a busy working week and the sort of hours that you work on the one side. So I also find that it's important in setting an example within the workplace as well to try and encourage that to occur within the workplace. So we do a number of things in the workplace that promote the opportunity for people to get out and about, to take walks, to subsidise gyms, to close or open the stairs so that people can walk between floors, a whole range of things. And we've found, incidentally, that in our staff climate surveys, the things that have been valued the most amongst the whole range of things that we provide have been the annual health checks that are part of the government program and the wellbeing initiatives that we actually provide. They're the most valued things that we provide in our staff benefits program.
I can see Stan nodding in agreement there, a very happy person. Stan, yourself?
So when we talk to people about living longer and being healthy and working longer, we use a very simple acronym, DEES. So the D is for don't smoke, so I don't smoke. The E is for exercise regularly, so each morning I try and get to the gym. Yes, well, you wonder why, what's not working there. Because, of course, the next D is eat well, so, okay, we'll just skip over that one.
I'm really glad I asked this question.
Thanks, that's a very personal. The following D is about de-stressing. So, and de-stressing is really about doing something in your life and trying to do it as frequently as possible that you enjoy. You know, whether it's reading a book, you know, just doing something, and that's what I try and do. I always try and do a little bit of reading at night. And finally, and probably quite importantly, and it sort of links into environment a bit too, is the S is for be social. So the connectedness, the socialisation in whatever environment it is, so to try and maintain common, frequent and regular social contact with friends and acquaintances.
I haven't had the pleasure of meeting Dr. Frumkin one-on-one, but when I was told about Dr. Frumkin, they said, absolute dynamo, full on, 100 miles an hour. And you look very fit, so your personal day-to-day fitness regime?
Well, I'll mention a couple of things. One is I want to go back to the comment on leadership. When we moved into our new facility at the CDC, we built a beautiful staircase surrounded by...
Sorry, Dr. Frumkin, just the mic here. Probably, it's nice to look at me, but just so you can look to the mic so you can hear.
So when we moved into our new facility at the CDC a few years ago, we designed it with a beautiful staircase surrounded by glass windows with broad platforms perfect for socializing and schmoozing. And we put the elevators in a relatively clandestine place in the lobby, reversing the usual practice. I then adopted a no elevator, no escalator rule for myself. So I'm on the 7th floor. I had 1,000 people reporting to me, and I was seen every day walking up and down the stairs, and it set an example. So I think both having the architectural design that declares we value using the stairs and then having leadership model that behavior turned out to be helpful. For one thing, when I was tired and wanted to use the elevator, I couldn't. Yeah. I had set a standard. I run every day and I paddle on the weekends and try to keep fit.
Sometimes do you think you're facing a losing battle? Because I do a lot of work in the States, and I love the States, and I love my colleagues there, but continually it's, Dave, let's have morning tea, let's go out for lunch, let's have dinner out. What about a snack later on? And when they present a lunch, I love my food quality and quantity, but I never finish an American meal. It really is a society of eat, eat, eat.
It's a society of excess, and we've really had to pay a lot of attention to supersized portions, train people not to take those. When I go out to dinner now, I generally order an appetizer and not an entree. The appetizers are so big that they suffice. If you order the entree, you eat the whole thing, and then you've had more than you want by the end of dinner.
What do you think the greatest challenge you have in the States in the years to come is?
Well, we've got challenges in terms of health and in terms of weight, both on the intake and on the output side. We're eating too much food, and we're eating calorie-rich, unhealthy food, so we need to move more toward fresh food, eating lower on the food chain, both for environmental reasons and for health reasons, and eating less frequently. On the output side, as we've said all morning, we need more physical activity. And in a service economy, that's difficult to build into people's routine lives. In the workplace, there are programs to do that, and we've been moving more and more toward this concept of healthy community design. If people live near where they work, if children live near where they go to school, they can build routine physical activity into their days rather than having to go everywhere by car and engineer physical activity out of their lives. So I think we'll be moving more toward smart community design in coming years as well.
Have you got enough parks?
Parks vary a lot from city to city. I happen to live in Atlanta, which by any measure has one of the lowest levels of parks per acre and per capita of any city in the country. As we move more toward sprawling development patterns, we tend to forget to build parks. So one of the very important initiatives nationwide and on a city-by-city basis will be to reclaim more parkland. We've taken advantage in Atlanta of a large amount of unused industrial and old railroad space, and we're now creating the largest urban park system in the country called the Beltline. It'll surround the city with a network of trails and fields and public venues. It'll take 20 or 30 years to construct, but we hope that we'll remedy our situation by doing that.
It's been mentioned about reading and relaxing, smelling the roses, as we say. Just to each panellist, if there was something that, a document you've read, whether it's a book or a published article or a journal, that perhaps we should just make a quick mental note of now. Dr. Frumkin, what would you suggest we read? Something that you've said they're pretty well spot on with this issue.
Well, one source that I think everybody in the room has heard of during the last week is called Last Child in the Woods. The subtitle is Saving Our Children from Nature Deficit Disorder, and the author is Richard Louv, who's here at the conference. He's a journalist who's pulled together a lot of the very good recent thinking about children's need to be in the outdoors. But the other one I'd recommend, and this goes back to one of William's slides, is a book called Happiness by Richard Layard, who's a British economist, who points out that although we run our economy based on the assumption that if we get more stuff, we'll be happier, in fact, higher prosperity levels don't necessarily correlate with greater happiness. The strongest determinants of happiness are social connections with family and friends, a happy work life, good health, rather than more prosperity. So it's a reminder, it goes back to the de-stressing piece and the social networking, that some of the most important ingredients for happiness and for health and well-being are not the things that we can buy with money.